Welcome back to Great Day, Louisiana. It is important to stay informed during this current COVID-19 crisis, but how do you find the right balance and not get overwhelmed by all of the information? Well, here to tell us some of the resources that are offered is our friend to the show, Dr. Jeremy Wigginton. He is the medical director of Blue Cross and Blue Shield of Louisiana. He is joining us now via StreamYard. Jeremy, I love your brick wall. Look at us matching this morning.
We're twins this morning.
Absolutely. Thank you so much for joining me this morning. I know you are a very busy man, especially right now with this current COVID-19 crisis. Thank you so much for being on the show to talk about everything happening. I really want to talk about basically our current state. You know, for me, I'm still struggling to find if I should wear a mask or not wear a mask. That is the latest thing the president has come out saying that we should possibly do. I want to hear from a doctor. Should we be wearing a mask when we go out?
Sure, that's a really good question that a lot of people are asking right now. And as you know, the Centers for Disease Control, or the CDC, has recommended that we all wear a mask when we're going out into public places. And a cloth mask has actually been the most recommended because it's easily obtained. And you can use something like a bandana or a square piece of cloth. The CDC actually has a video on their website that can show you how to make a simple mask out of some cloth and 2 rubber bands. So it's actually quite easy to make a mask yourself, because we know that the coronavirus, the virus that causes the disease COVID-19, can be passed person to person. And one of those ways is through droplets or coughing and sneezing. So little droplets of water come out and they can spread the virus. So wearing that mask will actually help to prevent the spread of the virus. And so since we're going to be in close quarters, especially places like grocery stores, those essential places that we need to go on a daily basis, it has been recommended to just go ahead and play it safe and wear a mask if you can.
Absolutely. And of course, as a reminder, definitely to keep social distancing. And when you do have to go out in the public, try to practice that 6 feet away rule. It is very important. And I can tell you a lot of grocery stores have been doing that. So I respect all of them for doing that. When you go out, you see the little feet saying, stand right here, which is great for people. I want to talk about now some tips for people who may be feeling anxious and fearful. What advice do you have?
Of course, this, as I've said before, this is so new to everyone that it is quite scary when you're having to deal with something we've never had to deal with in our entire lifetimes. And so staying informed is one really good way to stave off that anxiety, is to keep yourself informed, but sticking to very reliable sources of information. When we go to places like social media for our information, it can often be, number one, incorrect, and number two, a bit sensationalized. So we want to make sure we're getting it from a very reliable source like the Centers for Disease Control or the Louisiana Department of Health, and trying to set aside a small amount of time each day to get your information instead of focusing on the information 24/7. Those are really good tips to try to keep yourself informed but not overwhelm yourself.
Absolutely. It's very important. And I know you all are very busy. Emergency rooms are very busy right now, but you all have some resources if people still need to go see a doctor but don't want to necessarily go outside because they're afraid of getting COVID-19. Tell us a little bit about telehealth.
Of course, telehealth has been around for a while, just hasn't been quite as prevalent as it is now. We have our own telehealth platform called Blue Care. You can go online, bluecarela.com, see a provider online 24 hours a day, 7 days a week, which is covered under most Blue Cross plans to some degree. And also, now that the coronavirus has occurred, we have it in our communities, many of our doctors in the state and healthcare systems have launched their own telehealth options. And so you may want to talk to your own doctor or your own health system to see if they have their own telehealth options, which may also be covered under your healthcare plan. And so if you want to know what's covered in terms of telehealth, of course, calling that number on the back of your ID card, you can get information on exactly what telehealth is covered for you.
So if you are a Blue Cross Blue Shield member, I can use it. But if I'm not a Blue Cross Blue Shield member, I can't use telehealth?
So telehealth is actually a very broad term that means delivery of healthcare through video and audio, much like we are doing now. And so your doctor or your own healthcare provider system may have a telehealth system that they've created themselves, which you can then use whatever insurance you have to access telehealth. And so again, if you don't have Blue Cross, just calling the number on your identification card and talk to the customer service representative about what your telehealth benefits are. That will really give you information on exactly how to go about seeking care through telehealth.
Very interesting for sure. And real quick, I just want to mention you all's website. I was on it this morning. It's giving up-to-date information about the coronavirus. So, Doctor, thank you so much for joining us this morning. And again, to you and all of the people out there who are responding to all these cases, we really do thank you for everything that you are doing.
Absolutely. We really appreciate having the opportunity to be here. Thank you.
Of course. Thank you, Jeremy. And I can't wait to see you soon.
Same to you. Thanks.
Absolutely. To keep up to date with all the latest coronavirus information, just go ahead and visit their website. You can log on to bcbsla.com/COVID-19.